Hey guys, I want to continue on and talk about the second segment of the series of these videos. And I want to go over one of the most important topics that we need to know for the NCLEX, which is hypertension. Okay, so let's begin by defining hypertension. What is hypertension? We can simply define it as a significant amount of blood pressure within the blood vessels, right? In which blood pressure can exceed 140 millimeters of mercury, and that would be the systolic, and 90 millimeters of mercury diastolic. Okay. Now, as a nurse, we can educate and remind the patient that lifestyle changes, such as smoking cessation and having a proper diet, is essential. Now, we also know that hypertension can lead to aneurysms, atherosclerosis, heart failure, and myocardial infarction, right? Or heart attack. Now, our patient can have what we call a primary hypertension, which is what we just spoke about, or the patient can also have what we call a secondary hypertension. And with secondary hypertension, it's usually caused by other diseases such as Cushing's disease. Now, we all remember that Cushing's disease is basically due to our patient having too much glucocorticoids, right? Now, another cause of secondary hypertension could be due to brain tumors or pheochromocytoma, right? Now, let's go over the meat and potatoes of hypertension that we need to know for the NCLEX in order to pass our NCLEX. And that would be pharmacology drugs used to treat hypertension. Now, let's first go over the first group of drugs, which are the diuretics, right? Now, basically, diuretics helps get rid of the sodium and fluid within the body, and it does this by interfering with the sodium absorption within the kidneys, right? And as a result of this, it increases the urine output in the body, and it decreases the preload and the afterload. Now, as a side effect or opposite reaction from these effects from the diuretic, our patient would be at risk for having hyponatremia, right? And with hyponatremia, it's basically an electrolyte imbalance in which the sodium ion concentration within the plasma is lower than normal, right? And hyponatremia is generally defined as when the serum level of sodium is less than 135 milliequivalents per liter, right? And it can be considered very severe if the serum level is below 125 milliequivalents per liter, okay? Now, another side effect is orthostatic hypotension and dehydration, okay? Now, let's go over the different types of diuretics that you will most likely encounter in the NCLEX exam, and that would include potassium-sparing diuretics, and one of the most common types is spironolactone, which is aldactone, right? Another group of diuretic is loop diuretics, such as furosemide, which is Lasix, right? Another group are the osmotic diuretics, and the most common drug of osmotic diuretic is mannitol. Okay, and lastly we have the thiazide diuretics, such as hydrochlorothiazide or hydrodiuryl. Okay, now when we give patient thiazide diuretics, we need to make sure that we need to inform our patient that thiazides can cause the depletion, obviously, of sodium and water, but at the same time, it can also induce hyperglycemia in the patient. Okay? Now, let's go to another group of medications used to treat hypertension, which are beta adrenergic blockers or beta blockers. Now, as you have learned in nursing school, beta blockers or beta adrenergic blockers are drugs that help lower blood pressure. It also lowers the pulse rate and the cardiac output. Now, keep in mind that sometimes there can also be other uses of beta blockers, such as treating migraine headaches, treating glaucoma, and beta blockers can also be used to treat MI or myocardial infarctions, right? So, since beta blockers are an essential part of the NCLEX, we really need to understand, how this medication functions. Well, beta blockers simply act by blocking what we call the sympathetic vasomotor response, right, within the body, and eventually this causes the decrease in the blood pressure. Now, for the NCLEX, try to remember that most of the beta blocker medications usually end with a syllable olol, right, or OLOL. And potential side effects of beta blockers that is necessary to know for the NCLEX can include orthostatic hypotension, bradycardia, nausea and vomiting, and diarrhea. Now understand that beta blockers can also mask the symptom of hypoglycemia. So therefore we have to be really mindful about that. So with all this in mind, we need to make sure that we monitor our client's blood pressure, heart rate, and rhythm before administering the beta blocker, right? And we should also monitor the clients for any signs of edema and assess the lung sounds for signs of rales or rhonchi, right? And when patients are taking beta blockers, it is very important for us to monitor the changes in the lab values, right? And we're looking at the protein, the BUN, and the creatinine, which can indicate nephrotic syndrome in our patient. And that's it for now. I will go over more of this topic in the next few videos. And again, I want to thank you so much for taking your time and energy in trying your best to pass your NCLEX exam, which I will know you will pass with flying colors and eventually become a super duper awesome nurse. And if you want more information about the NCLEX review and my NCLEX courses, please visit me at allnursingnotes.com. That's allnursingnotes.com, allnursingnotes.com. Have a great, blessed day. Take some time to cool off from your review. You don't want to burn yourself out, so maybe go for a quick walk, get some fresh air. And again, thank you so much. Good luck and God bless. Bye-bye.